My name's Doug White. I'm a rheumatologist. I look after people who have arthritis and a variety of other problems with bones, muscles and joints. I have a particular interest in a condition called ankylosing spondylitis that has a predilection for the spine. Now, this is an important condition to study because it typically comes on in people's 20s and 30s at a really important time in their lives when they're establishing their careers, when they're establishing their families. For all the conditions that we see in rheumatology, the ankylosing spondylitis has the longest delay between the onset of symptoms and getting a diagnosis. It's usually between 7 and 9 years. Typically people would be affected with back pain, and this is one of the problems really that leads to the delay in diagnosis, because back pain is such a common symptom. Most of us get it at some stage. People have a predisposition to develop spondylitis. There is a genetic risk. And in fact, some of the work that we've done has been looking at the prevalence of the genetic risk factors in the New Zealand population. There are some environmental risk factors as well. We know cigarette smoking is quite an important risk factor for developing this. If we're able to pick people up at an early stage of their condition, we can make a big impact on how the disease affects them over the course of their lives. Because it's not a particularly common condition, we estimate there's about 20,000 people in New Zealand with the condition, and it's important to build up an expertise in this area. So we've done a variety of research projects looking from a health economic perspective, looking at genetic markers that can help us with earlier diagnosis, and looking at the associations with other genetic conditions. And importantly, we've been involved in the development of some new medications to treat spondylitis. Part of the work that we've been doing has been to teach others about spondylitis, as well as to generate some new findings around this condition. So I'd really like to see the delay between people experiencing symptoms and them having a diagnosis shortened, if we can manage that.